All right. Well, welcome to this session. 11 o'clock in Los Angeles, 2 o'clock in Kalamazoo and Savannah and Washington D.C. And I mentioned, of course, Kalamazoo and Savannah because we've got some great guests, and I'm just really honored that they're making time to be with our state of reform community here at this event. We have Congressman Fred Upton from Michigan's esteemed, I think, sixth legislative district, formerly the fourth, if I recall correctly. Congressman Upton, thanks for making time to be with us. I appreciate you being here.
You bet. Glad to be with you today.
Yeah, and I know we've got Congressman Carter, who's going to be joining us here in progress. He's going to be with us in a little bit. We also have Congressman Michael Burgess from Texas's 26th legislative or congressional district. He was wanting to be with us today, had to reschedule something at the last minute, and so we recorded his comments. We'll play them at the latter portion of this session. So I want to jump right in with you, Congressman Upton. Why don't you first just tell us about the district that you represent? We've got folks from all across the country. Tell us about your community.
Well, it's good to be with you. I represent Southwest Michigan, so I can actually see Lake Michigan across the street from my side porch. My big city is Kalamazoo and Portage. And of course, they are known, they have Pfizer's largest facility. I was there last week. It's where they actually are producing and manufacturing the Pfizer COVID vaccine. It was great news when they rolled the trucks out back in December. And of course, this is our main mission now. We need people to get more vaccines. Michigan, we're really at a peak now. We're soaring, sadly, in terms of new cases. I've talked to a number of my hospitals today, the governor's office as well. We're trying to get more. And one little side note. So a number of years ago, when I chaired the Energy and Commerce Committee, we were able to pass on a bipartisan basis an act President Obama signed into law called 21st Century Cures, or Cures for short. This expedited the approval of drugs and devices, and it really provided the foundation for the EUA, the Emergency Use Authorization, that the FDA now has used in approving these vaccines. And it allowed companies like Moderna and Pfizer, and now Johnson & Johnson as well, to actually begin to produce the vaccines before they were approved, so that on that day back in December, when Pfizer got their EUA, they could roll out the trucks that afternoon and literally provide millions of doses that they sent across the country with FedEx and UPS. Same thing with Moderna, same thing with Johnson & Johnson. So in the past, and no shortcuts were taken in terms of safety. And in the past, we still wouldn't have a vaccine approved at this point. So it was major bipartisan legislation. We got it done. Mike Burgess, who's going to be on, I know, at the end of this hour, but Buddy Carter and others, it was an overwhelming bill that we passed, signed into law, and it really provided where we are today to be able to actually distribute this vaccine literally a year from when we first learned about this whole COVID mess.
Yeah, what an amazing story. I want to dwell on that for just 1 second. I see that Representative Carter is in our metaphorical Zoom room here. I'm going to let him in, and we may have some of our screen shift because we're producing this one a little differently than a lot of our other breakouts. But it's a pretty unique circumstance that the district in which the trucks were first shipping out the vaccine from Pfizer happens to be the district in which the member of Congress chaired the committee that helped bring 21st Century Cures Act to America. You must, it's not every day you get to have like a 2 home run day like that, but that must give you an immense sense of pride, Representative Upton, to not just what you've done in Congress, but also your community. What do you take from? It seems like a really cool experience.
Well, Southwest Michigan, we're actually home to a lot of pharmaceuticals as technology corridors, and Upjohn started in Kalamazoo. It got changed, it's merged a couple times, Pharmacia, and then now with Pfizer. Stryker, which is a medical device manufacturer, one of the largest in the world. Their headquarters is literally across the street from this Pfizer facility in Portage, Michigan. So we've got a lot here, but we're, and I got to tell you, that Sunday back in December, I mean, it was like watching the moonshot. I mean, the whole world watched literally as these trucks left with state police protection up to the airports to get on the FedEx and the UPS planes to go everywhere so that we could actually begin injecting people with that shot that very next day. So it was an exciting time, and they worked hard. I've been at their facility lots of times over the years, including again just last week. They're actually going to be doing literally a $500 million expansion there that we broke ground on last week, as this is a major facility. And as we look to the future, having a vaccine ready for the variants, ready, we know that the current one, of course, the current vaccine is got a limited time span. We don't know how long it'll be, 6 months, 9 months, 1 year. It's not like the polio vaccine, one time and you're done. It's more going to be like the flu shot, I think, for a long time to come. But we got to make sure that we have the research, we do the approvals, that it's safe, and that we move forward. And of course, we're lucky in this country to have a pharmaceutical industry that, as the chairman of Pfizer said, we're going to spend whatever it takes to get this vaccine approved. And by God, they did it. Yeah.
Great stuff. And I want to remind folks, of course, that you can post your questions here in the chat box, on the right, and upvote those. I'll make sure we integrate those into our conversation here. We also have Representative Buddy Carter, who is with us from Georgia's great 1st Congressional District, and anchored by Savannah. Let me ask you first, sir, to just tell us about the community that you represent. We've got folks all across the country joining this conversation. So what does the 1st Congressional look like?
Well, first of all, thank you for having me. And I do have the honor and privilege of representing the 1st Congressional District of Georgia, which includes the entire coast of Georgia, over 100 miles of pristine coastline, as I'm sure Representative Upton will attest to, because he spends a lot of time down here. I believe his family has property down here, and we appreciate that. I hope you spend a lot of money in our district. We need it.
I talked to my mom and dad just today, although I'll say they're anxious to come back to Michigan next month. Get warmed up.
Yeah. But it is a great district. It starts at the South Carolina state line, goes all the way down to the Florida state line. As I say, 100 miles of pristine coastline. Has 2 major seaports, the Port of Savannah, which is the number 3 container port in the country. And we're very proud of that. Actually the 3rd fastest growing port in the world. Only 2 ports in China are growing faster than the Port of Savannah is growing. We also have the Port of Savannah, which is the Port of Brunswick, which is the number 2 roll-on, roll-off port in the country. Very proud of it. Right now, we got a little bit of a problem there in the harbor with the Golden Ray, but it's being removed as we speak, and hopefully will be out of the way soon, but it hasn't slowed us down. We've continued with the commerce, moving back and forth, so that's really good news. We also have a strong military presence. We have every branch of the military represented in the 1st Congressional District: Hunter Army Airfield, Fort Stewart, Kings Bay Naval Base, Moody Air Force Base. We have 2 Coast Guard stations, one in Savannah, one in Brunswick, home to the Federal Law Enforcement Training Center and Glencoe and FLETC, and where many of our police officers, our federal officers are trained. And we also have a very strong ag presence in our district as well. Lots of pine trees in South Georgia. So it's just a great district. No, seriously. 435 districts in the United States, and I get to represent the very best one. So,
I don't
know. Thank you both for being here. I really appreciate it. And like Congressman Michael Burgess, you all serve, of course, on the Energy and Commerce Committee. Our attendees know that that's one of really 3 key committees in terms of healthcare jurisdiction or health adjacent jurisdiction in the House. So Congressman Upton, let me ask you, what do you think the year ahead, or maybe the entire 117th Congress, looks like in terms of work that you're likely to deal with in the Energy and Commerce Committee?
Well, we have a lot of issues. I mean, let's face it. Sorry about that. It's my phone. we have a lot of issues, and our committee, Energy and Commerce, is viewed as really probably certainly the most important of just about all of them. And we got some great committees, Ways and Means, Appropriations, but Energy and Commerce, our jurisdiction is more than any other committee. We've got a lot of issues, so we're going to be tackling the infrastructure, and of course, on the energy side, we've had some hearings on as it relates to the Texas, to the big storm they had a few weeks ago, and we're going to be doing healthcare again. Actually, I'm working again on a revised version of 21st Century Cures called 2.0. We're hoping to unveil a number of the proposals a little bit later this month, early next month, as we are writing legislative language. Really do an update to use real world evidence in terms of some of the issues to help faster develop drugs. We've got a big hand on the NIH for research. When we passed 21st Century Cures, we included a $45 billion increase for the NIH in the research budget. We've seen great advancements in the 5 years since President Obama signed that into law. Drug prices are, that's always an issue. We were able to pass legislation this last year in the very last bill that President Trump signed into law on surprise billing to make sure that people didn't get those surprise packages that were maybe $30,000, $40,000, $50,000 that the insurance company wasn't going to cover. Buddy had a big hand in that, as we both serve on the health subcommittee. So lots of issues. The infrastructure, we're going to have a part of that as well. So, but it's different, and I know Buddy would agree with this. It's different because we're operating on Zoom. I got to tell you, it's a lot harder to do a bill, to have a markup, to have a hearing, and you got different time zones. You can't start a hearing at 9 o'clock because that's 5 or 6 in the morning on the West Coast. You can't go too. I mean, it's wholly different, and I think we're all anxious to see a return back to normal and to get back to where we were once before. But bottom line is, we have a divided government, 50-50 Senate. Nancy Pelosi, if she loses more than 2 Democrats, she loses. So you have to work together to try and get things done. That's been a hallmark of our committee in terms of getting things done. Not only with my chairmanship, but Greg Walden, Frank Pallone has tried awfully hard as well. But at the end of the day, if it's not bipartisan, the chances are it's not going to get signed into law.
Yeah, it's a great point. The Energy and Commerce Committee, or the ENC, has got a longstanding reputation of being pretty collegial and bipartisan in its work. And of course, that owes to both of your participation and leadership on this. I want to ask this question from Brian Bills, who asks, and Representative Carter, I'll have you jump in on this and offer your thoughts. He wonders about how the Republican conference think about government's role in encouraging preventative care, trying to get upstream out of the higher cost, maybe the more difficult areas of healthcare, and maybe trying to move upstream. And he asks about the framings that preventative health feels like a productive and positive kind of frame. And I'm wondering about your thoughts on preventative care, and also how to talk about it, some of these healthcare policy issues, in a way that garner support.
Well, first of all, that is a great question. And it's something that I've been dealing with for a long time, not only in Congress for the past 6 years, but also when I was a member of the Georgia State Legislature for 10 years, in the House for 5 years, and in the State Senate for 5 years. And it's tough to get legislators focused on preventative care. And all fairness to them, a lot of what we do is just putting out fires and just reactionary. Whereas if we were more aggressive, and if we were looking more to healthcare as how we can be preventative, as to keeping people healthy, as opposed to just reacting whenever they get sick. That's something that's kind of, it's hard. As a healthcare professional, I can tell you that it's something that I've tried to do ever since I've been in the legislature, in the state legislature, or in Congress. And I do think the Republican Party has been receptive to it as a party, and I think they understand. But you got to remember, when we're talking about legislation to address an issue that already exists. And we've already done this. It's tough to get the focus changed to what can we do to help prevent this in the future. It's not impossible, certainly not, but it is tough. I just want to add this on too, and I want you to know that I do say this, whether former Chairman Upton is here or not. The Energy and Commerce Committee is, in my opinion, the most diverse, the most, obviously the oldest committee in Congress, and the most bipartisan. We do work in a bipartisan fashion, and I'm very proud of that. And that's one of the reasons I'm so proud to be on that committee, is because a lot of our product is bipartisan. Almost all of it is bipartisan. Unfortunately, in the very partisan Congress that we serve in now, once it leaves our committee and gets the leadership, and a lot of times it gets blocked or changed. But when it leaves our committee, many times it is, and most of the time, if not all the time, it is in bipartisan fashion. So, I hope that we will look at preventative medicine. I hope that we will look at well care, what we can do in that way. I think it's significant to note that we were talking about and discussing telehealth long before telehealth became the integral part of our healthcare system that it is today. We all know that during the pandemic, telehealth, as they say, made 10 years of progress in 1 week. Now, as I say, it's an integral part of our healthcare system. We were talking about telehealth in the Energy and Commerce Committee years ago and have been talking about it as well. And that's just one example, I think, of how our committee works and how our conference works, Republican conference.
I've had the luxury of having conversations like this one over the years, interviewing different members of Congress and other elected officials. And Congressman Upton, one name you may recall, that of Congressman Norm Dix, longtime appropriator on defense, a Democrat, told me once, said, forget what you hear about the other party in his committees, at least. He said, the enemy is not the Republicans. It's, the enemy is the Senate.
The Senate. No.
He was right. He was right. Give us a sense of how you are thinking about trying to put policy together when you've got such a closely divided Senate. You got to obviously pass both houses. Do you try to legislate with an eye to the Senate, or do you just try to legislate to get really good policy out of the House and then let them do whatever they're going to do?
Well, you have to have, we're lucky in that Buddy and I, we know a lot of the senators, and frankly, a lot of the senators that are over there came from our committee. Mm-hmm. I mean, I look at Mike Crapo, I look at Richard Burr, Ron Wyden was on our committee. There's probably about 12 members in the Senate that came from our committee. I'm one that actually goes over there. At least I did before COVID, usually once or twice a week, even just to check in. I have relationships with virtually everybody that's over there. And, the other hat that I wear, I'm a member of the Problem Solvers Caucus. This is a group of 58 members, equally divided, Republicans and Democrats. I'm one of the vice chairs, so we have 5 members from Michigan. And we've been instrumental in not only changing some of the rules of the House to foster more bipartisanship, but also to work on some pretty key issues that America needs to deal with. And we have, again, relations with the Senate on this as well. So I'm glad that April 1st is now behind us, because what Speaker Pelosi was able to do this year was she, in a rules package that passed the first day that we were sworn in, she used the bills from the last Congress when her margin was much more. Remember at the beginning, I said, she loses right now 2 Democrats. She doesn't win. More than 2 Democrats, she loses. And so she was able to muscle a number of these bills through that were under the last Congress when she had larger majorities in every one of the committees and denied any amendments on the House floor. It was just the way that it was. But that expired April 1st. So now it's incumbent upon all of us, particularly our committee, again, which has so much jurisdiction, to try and work together to come up with the good ideas from both sides of the aisle and to move those bills forward and not get caught in a partisan trap. But he's exactly right when he talks about telehealth and more money for broadband. And we sure have seen the need for that with COVID this last year. I'm hoping that we do an infrastructure bill that's bipartisan. And one of the elements that'll be in there is more money for broadband for both rural and urban areas that are underserved as we try to catch up with the 21st century. It's critical that we get this thing done as we look to the future, whether it's to improve our quality of life or to compete with the rest of the world.
Representative Carter, what do you make of the the American Rescue Plan Act, or the American Rescue Plan that was the Democratic bill that ran through the Senate on reconciliation, of course, passed the House, I believe, without a vote from the Republican Party. It's a big bill. There's a lot in there. There's a lot to like for a lot of different kinds of people. But what are your thoughts in general on that bill, and what should folks make out of such a big bill on healthcare?
Well, first of all, the fact that it's $1.9 trillion and less than 9% of it was used for healthcare or for COVID pandemic related issues, that tells you right there part of the main part of the problem. The second part is, that it received no Republican input nor any Republican support whatsoever. That again shows you that it was a purely partisan bill that was nothing more than to pay off the supporters of Nancy Pelosi and Chuck Schumer. And it's very unfortunate. Speaking somewhat selfishly, for the state of Georgia, we lost $1.3 billion because of the formula that was used. The formula was based off of the unemployment rate as opposed to population. Georgia did not close down our state completely. We did cut back, but we didn't close down our businesses, and therefore we didn't destroy our economy like some of the other states did. And therefore, our unemployment rate was not as high as some of the other states were. Therefore, we lost out on $1.3 billion simply because we didn't close down our businesses. A second point is that we also lost $11.5 billion in the state of Georgia to Medicare for our seniors over the next decade, again, because we didn't close down our businesses. And that's unfair to the citizens of Georgia to have that money go into states that did close down their businesses, that destroyed their economy. So from that perspective, I really cannot say that I agree with the bill. You are correct. There are some things in there that are good. That money that was spent on PPP, that turned out to be one, in my opinion, PPP was one of the best federal programs that we've ever come up with, particularly in a short period of time. You got to keep in mind, 15 months ago, PPP didn't even exist. It was created in a short period of time. I'm sure there was some fraud, waste, and abuse in it, but for the most part, it was an excellent program. And, I believe in giving credit where credit's due, and the federal government did a great job with it. Well, the $1.9 trillion did have more money in it for that. That's good. We need that. But again, all you need to know is that it was completely partisan, no Republican support, no Republican input. And therefore, I have to say that I think it was a terrible opportunity that was wasted on the part of the majority party.
Representative Upton, given that first, that's not the only thing that has happened in Congress, but that was a big ticket item. Now that we've got from the Biden administration this infrastructure bill with pay-fors in it, like an increase of the corporate tax rate up to 28%. I know you said you want to get to yes on an infrastructure bill or a bipartisan support. What do you think has to happen for the infrastructure vision and the pay-fors that come along with it to get bipartisan support in the House? What does that look like, you think?
Well, a couple of things. I got to say that the idea to increase the corporate tax rate to 28% from 21, that is a bad slippery slope. One of the best things that the Trump administration did was to really see tax relief. We had the highest tax rates for corporate tax rates in the world. We saw businesses, I know, leave my state. Maybe they wanted to go to Georgia, but they went to Ireland and they went to Canada and they went other places because of that tax rate. And it was a wonderful piece of legislation that really helped the economy move forward, at least until COVID, which let's face it, shut virtually everything down. We had the best growth in every demographic sector that you could imagine. So as we look at this next infrastructure package, I've weighed in with the White House already. I said, hey, I listened to the president's speech on Inauguration Day. He talked about being bipartisan. This is an opportunity to do that. But raising the corporate tax rates, you're not going to get any Republican votes there. So that sort of needs to be taken off the table. But we have to look at what we've done. As Buddy talked about this last COVID package, he's right. Not a single Republican voted for it for a lot of reasons. One reason was that there was $1 trillion still unobligated from the last package that President Trump signed into law at the very end of December. And a lot of this money in this last package that Biden signed isn't going to be spent until next fiscal year. So how is that an emergency? So I think we need to look at what's out there already. This is $2 trillion is what he unveiled a week and a half ago. He still hasn't told us what his budget is going to be for fiscal year 22, which starts October 1st. But, that's probably another $2.5 or $3 trillion on top of that. So those of us that are concerned about debt and, where interest rates may go down the line, let's really look at these programs. From what I'd like to see roads and highways, a real infrastructure project. I'd like to see ports, and I hope you don't get that ship, the Evergreen, down there in Savannah. Those 20,000 containers on there, but there's a real issue on shipping, whether it be on the Great Lakes or whether it be on the east or west coast. Buddy's right on that. We need more money for the Corps of Engineers for dredging and those things for economic development, economic activity. We need broadband. We need to make sure that our health systems, and right now here in Michigan, I don't know if you've heard, but our COVID cases are like number one in the country in terms of surge. Our workers are tired. We're going to need some relief, I think, for that end of the deal. But I think that frankly, without looking at all the details, it probably can be scaled back some, jettison these tax hikes that'll again hurt businesses and move forward. There's room for a bipartisan deal, and one that I think could get at least half of the Republicans to vote for it, and be a pretty big feather in the cap for the Biden administration, because he'd be able to walk the talk of what he talked about on January 20th. That is, reaching out to both sides of the aisle, both the House and the Senate.
Well, I know we're at time. I just want to say thank you to you both for making time to be with us in our community here at State of Reform. We're super honored that we've had you. And if we can ever put wind in your sails in terms of giving you a platform to talk with our community, we would be happy to do that. Representative Fred Upton from Michigan's 6th Congressional District, based in Kalamazoo, and Representative Buddy Carter from Savannah, the Savannah area, the 1st Congressional in Georgia. Thank you both members of the House Energy and Commerce Committee. I appreciate you being with us, fellows. Thank you.
Great.
We're going to hear from now Representative Dr. Michael Burgess, also a member of the Energy and Commerce Committee. He was unable to join this session live, and so we recorded his comments here just the other day. So we'll jump now to Representative Michael Burgess. All right, well, welcome to this next part of our conversation here with some of the Congressional Republicans. And we're super honored. I'm personally honored to have the senior physician in the U.S. House of Representatives, Congressman Dr. Michael Burgess. Doctor, thanks for being with us. I appreciate it.
Well, thanks for having me on with you.
Before we get into your biography, I want to introduce some of our folks here to your prognostication and your prediction abilities. This is what you had to say, Congressman, on February 2nd, 2020, so just before lockdown started in the United States as a result of COVID. Let's watch.
The other thing that I didn't mention, and I apologize about this, but overshadowing everything that we're talking about is this damn coronavirus. And I will tell you, having been in Congress through SARS, through bird flu 1, swine flu, bird flu 2, Zika, and Ebola, I'm as concerned about this one, more concerned about this one than I have been about any of those other episodes of public health crises that we've faced. The numbers that I'm hearing, and I'm sure they're not up to date, but it went from 7,000 cases last Thursday to over 20,000 cases by Tuesday. That's a tripling in 5 days. The lethality rate is not as great as with SARS, but the infectivity seems to be easier, more facile, and the individual to individual transmission of the virus is one that all of us should be very concerned about. And the other thing is the possibility, I don't know whether it's been absolutely proven yet, but the possibility that someone can be infective before they're symptomatic. And that is that really raises some serious concerns.
Now that we've reflected on those comments, what do you think of where we are today in terms of COVID? Just, what do you make of those comments a year ago and where we sit today in April of 2021?
Well, when I watched those comments from a year ago, I feel somewhat vindicated. At the time, I was the Chicken Little of the Congress, telling people the sky was falling and no one would believe me. Well, yeah, sure enough, the sky was falling. But here's what I didn't know then and what I couldn't know then. What I didn't know then and couldn't know then was the great news that was right around the corner with Operation Warp Speed. When I went to those briefings a little over a year ago and heard the discussions from the public health people, it was, we are going to beat this illness with public health measures that have worked in the past. So things like contact tracing, quarantine, these are going to be the tools that we will use, public health tools that have been used for generations. Of course, as I think I said in the comments at the time, what couldn't be known about this virus that day was the very long latency period between the time someone is exposed, has the virus, that is capable of transmitting the virus, but has no symptoms. So that asymptomatic shedding period is really what was different about this bug. And of course, all of the public health experts could not have known that then either. And that's what led to so many of our problems as we felt our way through the year 2020. Now, look, none of us in our right mind would go hang out with someone who's obviously sick in the time of a pandemic. The difficulty was the people who were actually capable of transmitting the virus didn't look sick. They might not get sick for a week or two later, and then sometimes, unfortunately, they get very, very badly ill. The other thing was there were vast segments of the population that weren't affected, but it took a lot of courage to put the investment in place that led to the rapidity with which the vaccines were developed. And look, let me just share this with you, because I came from a mobile vaccine clinic this afternoon and saw literally the tens of thousands of people who are driving through and getting their shots in the congressional district that I represent. But I'll tell you, the night of December 13th, I'm sitting on my sofa. It's a Sunday night. I'm watching the 10 o'clock news before going to bed. And this little news story comes on about the FedEx trucks getting ready to leave the lab in Kalamazoo, Michigan, to carry those first doses of the Pfizer vaccine to the locations where they'd be administered. I was not prepared for the emotional reaction. The emotional reaction that I had, it really was almost overwhelming at that point, because of the fear that we had all lived with for a full year's time, because of the restrictions on our own activities, what we had to do in our own lives to get through this. And now the day was dawning where we would be through this. And while I always believed that we would get through this, while I always believed there would be another side to this story, the side of healing and emergence, I honestly did not know some days how we got there. But that story about the Pfizer vaccine being delivered out of Kalamazoo, Michigan, and taken on the trucks to get on the planes, to go to the sites, to get in people's arms, that truly is an astounding American success story. And people should be properly cognizant of what all was involved to get there. And now the rollout with the vaccine, some fits and starts, but for the most part, what I saw today at my mobile vaccine clinic was 10,000 people getting a shot that will now protect them from this illness and allow them to have the family gathering that they've put off for more than a year. It's a powerful, powerful moment when you realize what is going on at a site, at a clinic like that.
Yeah, powerful indeed. And we're going to hear at our keynote on Thursday afternoon from David Herring, the president for Pfizer for North America, who has led some of that vaccine work. So we're excited to hear from him. I want to step back for just a second, though, and get out of the sort of visceral experience of COVID and hear about your biography. A lot of folks who are here watching this, they're getting to know you for the first time. And let us know how you came to be, a physician, how you came to get yourself here in the Congress.
Well, all of those are very long stories. The short story on my path to being a physician was my dad and his dad were both doctors. So I guess from some aspect, it was already imprinted in my DNA that it's a career path that would appeal to me. I went to medical school down in Houston. I graduated in 1977, seems forever ago now. The University of Texas Medical School at Houston had a 3-year program at the time. In fact, Dr. DeBakey across the street at Baylor referred to us as the junior college one day. But I made it by my point to show that those of us who went to the relatively new school in the city of Houston could excel as well. So I set my sights on a residency at Parkland Hospital in obstetrics, one of the top places to train in obstetrics in the country. Always be grateful for the time that I had at the large city-county facility in the city of Dallas. Came a few miles north to practice medicine for 25 years, was quite happy in the little town of Louisville, Texas, up in Denton County, being an OB-GYN. Something happened to me on 9/11 that made me, when I watched all of the events unfold that day, it made me question, was I doing with my life what I was supposed to be doing? Was there something else that maybe I should consider doing? So while I was in the middle of pondering that existential question, my then current member of Congress decided not to run for re-election. So he'd been in office for 18 years. It'd been a long time since I'd seen an open congressional district where I lived. But I worked through some of the logistics, not all of them, I promise you, but some of the logistics on what it would take to file and run for Congress. And I did so. It was easy to file, hard to run. I kept my practice going the entire time, but a lot of things, I was very fortunate in a lot of aspects, and ended up winning the primary, and then of course the general election in the fall of 2002. Coming to Congress in January of 2003, I knew I couldn't continue to practice medicine, so it was difficult to give up the practice of medicine, something again that I felt like I had been, that had been part of my internal makeup, part of my DNA. But at the same time, I realized that this is also very good work, and you can help you can help a lot more people simultaneously than you can as an individual doctor in an individual operating room or treatment room. But on the other hand, I always will have so much respect for those who do put themselves out there on the front lines of our healthcare team, our doctors, our nurses, our technicians who work so hard, who literally brought us through this crisis.
A lot of folks watching this are political geeks like me, and will appreciate, if I recall correctly, that the former member that you mentioned was Dick Armey, the House Republican Majority Leader for a time, and you took on his son, I believe, in that primary that you mentioned. What was it like taking on really a very powerful Dick Armey machine back in those days? Must have been a consideration to take on such a big name.
Well, realistically, I actually did not know quite what I was up against, but I don't know. Maybe if I'd been smarter about things, I wouldn't have done it. But I do feel like I'm at the right place at the right time. I wouldn't continue to do this if I didn't feel like I was making a difference, and indeed I do. I'm very fortunate. I serve on the Committee on Energy and Commerce. Obviously, they've got a big healthcare footprint in that committee. The CDC, the FDA, NIH are also under the jurisdiction of that committee. Has a big energy component, and Texas is a big energy state, as well as the front lines and all the tech headlines that are available to people now. I'm also fortunate to serve on the Rules Committee. That means I get to look at every piece of legislation before it comes to the House floor. And for reasons that I don't understand, I was asked multiple times to serve on the Budget Committee this term in Congress. I turned them down 3 times. The 4th time it stuck. And now, as you look at how the events have unfolded in this Congress, and I realize we're only 3 months into it, but a lot of the legislative work is actually coming through a process known as budget reconciliation. And if your audience is more savvy than I was when I was a practicing physician, they understand that the Budget Committee now is a big part of where a lot of the decisions are made. I'm still in the minority as a Republican. We don't get many wins, but it is important to put ideas out there and to try to win in the marketplace of ideas. And that's really how I'm spending my time these days.
You were a central figure in that 2017 effort by the House Republicans, by the Republican Party in both chambers, really, and President Trump at the time, but in the House to develop a repeal and replace strategy and piece of legislation that ultimately passed, repeal and replace of the Affordable Care Act that ultimately passed the House. It fell a vote short in the Senate. Nobody ever really knows what it's like inside a party conference or party caucus. And so I'm wondering if you could just give us some sense of what it was like just pulling together the different parts of the Republican Party to get behind any legislation, regardless of the merits of what came or went in 2017. But what is it like to pull the caucus together to get them unified behind a bill?
Well, and I already mentioned reconciliation. This bill was done under reconciliation. And the one takeaway that I have from that is how difficult it is to write a bill that is going to be concurrent with Senate rules when no one will tell you what the Senate rules are or are going to be. So that made it difficult. Writing healthcare policy is difficult on any day. But the fact that you had to write a bill that would pass muster with the Senate parliamentarian meant that it was even that much more difficult. And I made the argument at several points, look, let's just pass what we want and let's see if the Senate can figure out how to make it conform to their rules, and that's their job. Ours is simply to get the best policy through. But for multiple reasons, it was felt that we needed to deliver to the Senate something that would pass muster with the Senate parliamentarian. Probably not the way I would advise anyone to go about doing things. We see the Democrats now working with reconciliation, and they're taking a little bit of a different tack. But the other big takeaway I have is that don't ever try to do something on reconciliation where you're depending upon where the vice president is going to be your tiebreaker, where you can't be sure that you have 50 votes going into it. And that was probably the hardest takeaway lesson from the experience with trying to bring improvements to the Affordable Care Act. And let me just touch on that for a second, because remember, one of the things that likely elected then candidate Donald Trump to the presidency was remember the open enrollment period that happened about a week before Election Day. That year, Election Day was a little bit later in November. And as a consequence, the open enrollment period for the Affordable Care Act had opened, and people saw such significant increases in their premiums that they were truly astonished, and not in a good way. So one of the very acute principles that was talked about on the Republican side was, if you don't do something that reduces premiums, if we don't do something that lowers the cost of this and does it pretty quickly, people are going to see this effort as having not been successful. Now, what I couldn't have known at the time, and what I did learn later, was even though we didn't pass the bill on that healthcare bill, simply repealing the individual mandate in the tax bill, the individual mandate that an individual or family has to buy health insurance, which of course was the cornerstone of the Affordable Care Act, as well as the coercive aspect of the Affordable Care Act that I maintain led to its difficult time that it had with popularity. Getting rid of the individual mandate was really one of the most potent things that could happen as far as holding down prices. I didn't know this at the time. Perhaps in retrospect, I should have known it. But by doing away with the individual mandate, where an insurance company no longer can say, it doesn't matter what you want, consumer, you have to buy what I'm selling because the government is requiring you to do that. That plus the president expanding what are called limited duration plans with an executive order, to be sure. That's never an enduring way of developing healthcare policy. But those two actions actually did result in premiums being significantly ameliorated for October of 17 and October of 2018, which arguably was one of the tasks that the president was elected to do. Help us with premiums. We can no longer afford it. We'll get to the problems with deductibles and copays later, but the premium is the number one obstacle that most people are facing, and they face a fine if they don't buy that very expensive health insurance that may not meet their needs. The president really solidified the gains that were achieved with repealing the individual mandate by expanding upon limited duration plans. And we can talk about some other things too, association health plans, health reimbursement arrangements, which the president also did on executive order. Those got tied up in some court cases. But those two actions, repealing the individual mandate, which was a congressional action, and then an executive action to expand limited duration plans, actually were what held premiums down. And that's what people were asking for. One of the things people were asking for when they elected Donald Trump in the fall of 2016.
When we had a little bit chronologically into the first quarter here of 2021, the Biden administration and more directly, the Democratic Congress passed the American Rescue Plan Act. It's a big bill, has a lot of healthcare in it. Give us your thoughts on that bill and whether that was helpful or maybe muddies the waters. What's your take on it?
I'd probably choose the latter, the muddy the water category. Look, there's no question. Again, healthcare policy is difficult, and anyone who tells you they've got an easy fix or an easy answer is probably being misleading. There's a lot of aspects of the American Rescue Plan that I don't know are well understood at this point. Yes, there was the President Biden's approach to helping people with the high cost of premiums is to bump up the subsidy payment. I would argue that it was the combination of the subsidy and the mandate that allowed the premiums to go so high in the first place. But the president and his team feel that bumping up the subsidy, the portion of insurance that the government will pay, that bumping up the subsidy and bumping up the income level where the subsidy is available will solve their problems. The difficulty is, though, life goes on. There's no, as far as I can tell in my reading of the legislation, there's not a cost of living adjustment. So you're going to have people who end up outside the subsidy window. And when they end up outside the subsidy window, if the premium has gone up unabashedly because the subsidy went up, guess what? They get stuck with an even higher premium now. And this, again, was what led so many people that I talked to tell me, you've got to do something to help us. This health insurance is too expensive. And then, of course, you couple that with the high deductibles. Look, I'd had a high deductible health plan for a long time. I'd had an old medical savings account, and then it morphed into a health savings account. So I get it with high deductibles. I understand the market principles in play there. But people who were not prepared for high deductibles, who saw those very high deductibles under the Affordable Care Act, really it left them feeling functionally uninsured. Now, what it will look like on the other side of the American Rescue Plan, I'm sure there'll be a lot of writers and think tanks who will tell us what the right answer there is. But in my opinion, I don't think they've solved the problem. They have moved the problem perhaps down the road a little bit, but it is still going to remain, for a lot of American families, it is going to remain a problem. Look, the way to deal with high deductibles, and I've talked to people in the administration, both the Obama administration, the Trump administration, and trying to talk to people in the Biden administration, haven't managed to get through to them yet. But there are things you can do to help ameliorate that deductible. In fact, in the old days, prior to the Affordable Care Act, United Healthcare had embarked upon a program. They were selling a policy with a $5,000 deductible, but you could bring that cost of that deductible down by engaging in some healthy behaviors that they wanted to incent: smoking cessation, weight loss, exercise regimens, and you could bring the cost of that $5,000 deductible down to a level that was perhaps more manageable for a family. Those are some things, you can't just always be telling people and restricting people. Sometimes you've got to encourage people. And that would be one of the ways, if I were asked by the Biden administration, how do you help people? Well, see if we can help them out of these situations they're in with high deductibles and the intractable copays that they experience. There's the other aspect of every premium dollar that you spend in the individual market is an after-tax dollar. So it's some of the most expensive dollars that you have to spend. Let's make those premiums pre-tax expenses in the individual market, just like you do in the large group market, in the employer market, where that coverage is subsidized because the employer gets a write-off. They get to pay for that with pre-tax dollars. Again, there are a lot of things that we could have done that, for whatever reason, people just choose not to do, and they're wedded to these big government solutions that they think are going to deliver the Elysian fields of 100% health care for everyone. And that, in fact, at the end of the day, that may not be achievable.
So where do you think there is room for consensus in the 117th Congress? Where do you think Democrats and Republicans will fall in line with one another to move health policy legislation?
Well, I think it's in the Energy and Commerce Committee. I've been on that committee for a long time, and I've seen it go through a variety of changes. But the Energy and Commerce Committee, in general, does not tend to be as partisan a committee as, say the Rules Committee or the Budget Committee, which are both intensely partisan. Not as partisan as the Judiciary Committee, that sometimes is intensely partisan. So, if there were room for bipartisan activity, bipartisan compromise, if you will, it likely would be in a committee like the Energy and Commerce Committee. We've got some important things. One of the things we face repeatedly in the Energy and Commerce Committee is a lot of these big public health programs need to be reauthorized. So the Food and Drug Administration is not this year, but next year, before the next congressional election, will undergo a reauthorization. Every 5 years is a reauthorization of the user fee agreements in the Food and Drug Administration. I would say that is, to me, an opportunity where we can look at, how the FDA do with this pandemic. How were there obstacles? You read stories about what's the total number of emergency use authorizations that were required to get us through the pandemic. It's in the hundreds. It's 200 or 300. Well, if you've got an agency that's requiring 200 exceptions in order to keep you alive during the emergency, maybe you ought to look at how that agency goes about those regulations. So the Congress, or the Energy and Commerce Committee, will actually have an opportunity with a reauthorization of the Food and Drug Administration to look at some of those aspects. The fine men and women who work at the FDA will be, I'm sure, anxious to come into our committee and explain to us why they do some of the things that they do, why they did some of the things that they did, what they feel that they got right, what they feel that may have been made it harder to get things through. But that's a big opportunity that we're going to have in the Energy and Commerce Committee. One of the last bills that was signed by President Obama was Cures for the 21st Century, passed in December of 2016. It was a work product of our committee, our subcommittees, our full committee. We had a variety. I think I personally attended 15 either subcommittee hearings, briefings, roundtables, not just in the committee room, but around the country, asking people who are on the front lines of medical research, and what would it take to get things through the process faster. We all want to be there for safety, but how can we get things done in a more straightforward fashion. I think the figure that was used, it takes 13 years and $1.3 billion to bring a new drug from the laboratory bench to the bedside. What can we do to bring that time frame down, to condense that time frame, not sacrificing safety, but to bring it along in a more straightforward fashion? To some degree, I think that's what you saw with Operation Warp Speed. Not entirely analogous, but still that mindset of how do we condense all of the regulatory authorities that we want the FDA to have, but can we do some of these things simultaneously? And that's what you saw with the streamlining of the process with Operation Warp Speed. Now, to be sure, there were people who were quite skeptical. You heard people last fall talk about, oh, these vaccines, they can't be trusted. They're hurrying them through. They're not paying attention. I have never seen clinical trials with the numbers of people. And bear in mind, you had a number of candidate vaccines, but Pfizer and Moderna and J&J, for example, each had 30,000 people. Each had 30,000 people in their clinical trials. Most clinical trials for a new product coming on the market may have 1,000 or 2,000, 30,000 people. And one of the requirements the FDA had was in your study group, there had to be a certain number of cases, people admitted to hospital, or unfortunately people that succumbed to the disease, so we can actually do an apples to apple comparison. Did this vaccine, did it provide protection from the worst aspects of this disease? And then when those studies were unblinded at the end of October, it was absolutely astounding that there was over 90% success rate with keeping people out of the hospital. I think, if I have my figures correct, that no one in the vaccinated group, there were no ICU admissions or deaths in that group. So it really was pretty astounding. Not just that we had a vaccine, normally our flu vaccine, we hit 40%, we're doing high fives. This was 90% effective, and Moderna, similar numbers, and J&J just a little bit under that, but there's the advantage of a single shot that doesn't require the ultra cold refrigeration. So all of these were individually would have been home runs, but when you take all of that in aggregate, that's a grand slam.
Congressman Dr. Michael Burgess from the great state of Texas and on the Energy and Commerce Committee, sir, thank you for making time to be with us. I appreciate it.
Yes, sir. Glad to do it. Thank you.